So, Ms. Gibson, did I hear you say that we can reduce or totally eliminate the overdependence we have on China, that we in our country have the capacity to create or manufacture these chemicals that are so necessary?
For a lot of medicines, brilliant chemists and pharmaceutical engineers can make these chemicals here.
And so why is that not happening?
Well, on the generic side, the margins are so slim that companies would not invest in the new plant and equipment to do it. And also, there's our last large generic company, Mylan, in Morgantown, West Virginia, merged with Pfizer. And Pfizer last year announced the opening of its global generic headquarters in Shanghai. So we don't have these companies there. In 5 years, there's two more Western companies. They'll be gone.
So we have a so-called free marketplace where companies can make those kinds of relocation decisions. So are you suggesting that there be some kind of legislation that will prevent or affect a cost on these companies that will take their manufacturing to places like China?
Well, I think sort of the horse is out of the barn on that. But how can we grow and incent small businesses that are eager to fill this very large vacuum that we have? They want to do it. Civica, I'm sure, would want to purchase essential medicines and all their ingredients made here in the United States. The DOD could purchase it, the VA. We could start a whole new market with manufacturing here in the United States.
I think we are going to need to figure out, though, because as if a small business creates these chemicals, et cetera, and they get bought up by a larger company that is interested in the bottom line, they go off to China. That's not resolving the situation. So we're obviously going to need to come up with some really, in my view, tightly drafted legislation that will get us to where we need to go.
There are some provisions that can be done that you can't sell your plant for national security reasons. These, if we make
Great.
any investment,
So
should be
those
national
are the kind of
security.
ideas we need to put in place, I'd say. Dr. Anderson, here we are in the midst of a pandemic. I mean, it's a here and now. And I know, any state that is so dependent on tourism is a major part of the economy. And I'd say most states, tourism is their number one or number two driving factor. So we're already seeing thousands of people losing their jobs. Most of them probably do not have paid leave, sick leave, or anything else. So here and now, I agree with you that we really need to figure out how to ease the impact on workers and their families in the here and now, because if we expect people, 20% who are not even insured, to go to the doctor, that's not likely to happen. I think this crisis has really illuminated and illustrated the huge gaps in healthcare coverage in our country and how it is creating a risk for all of us. So we can have that conversation later. But for the here and now, I'm wondering whether you think, Dr. Anderson, that we obviously need to have a lot more testing in our country so that we can get a sense of how far how much of this virus is already in our country. We do not know that. So testing. And then obviously we're going to see this continue if we don't develop a vaccine. Would you agree that testing and the developing of a vaccine are critical to our ability to get a handle on the spread of coronavirus in our country?
First of all, the vaccine is absolutely critical, but it's going to take a year or whatever.
And in the fall, this
hopefully
virus
it won't
may
happen
come back.
again, but it may resurge in the fall. Let me go back to the question, though, about what we can do besides for generic drugs, because we're now working with the state of California. And they have said that they want to essentially manufacture or produce drugs for the 13 million people that they insure. And they are trying now to do that based upon plants in California. And so they have the power of 13 million people that could manufacture drugs. And they're trying to do it with Civica and other places based in the United States. So the government has this huge purchasing power and can use it to do things that are manufactured or produced in the United States.
I'm all for government using its purchasing power, but note that we can't even under Medicare have a discussion about drug purchasing where we can't even negotiate those things. So I'm all for government using its power to create the kind of scenario, situation where drugs that we need are being produced for our people, and we apparently aren't there yet, but whatever you can do to raise your voices to head us in the right direction along these lines, I'm grateful.
But
Thank you, Mr.
Medicare
Chairman.
can't, but Medicaid can,
Yes.
DOD can, VA can, so there's a number of very important buyers in the public system that can.
Yes, Medicare, though, is a huge gap.
I understand.
I know. Thank you.